primary focus of our New Beginnings was to put together an institution where all of these resources could be available to individuals who have survived traumatic brain injuries.
Everything's different with him, and nobody really can explain to me how to handle somebody like that. You know, it's bad enough to deal with the physical injuries and the things you can see, but because my husband can walk and talk, everybody thinks he's fine, but they don't live with him and they don't understand that he's not fine.
Like you, Shannon, and like probably everybody here, he's a different person. And like you also, he appears to be fine, and that creates his own problems because people do not realize that he has a head injury.
So yeah, my father, I think he's denial. He doesn't realize that I have a short-term memory loss. He just thinks that, that I'm lazy or I'm just not as smart as I should be.
All these years, it's been difficult to say I don't know to people. Because they ask me questions about things that everybody else would remember, and it's kind of, and I don't know, and I try to give answers, and it would bother me that I had to say I don't know. Now it's screwed. I don't know.
Yeah, but he's just as kind-hearted, and not because he's my son. I hope you get to see him, but he inspires me because he truly is a miracle. He was 26 years old when he fell 50 feet onto cement and suffered a brain injury. And they didn't even know if he was going to live. But here it is years later, and his biggest thing that he has trouble with is speaking. He does say some things. And he can say, "I love you," and I said to him, if you never say anything else to your mother, that's all you need to say.
It was Robert's 21st birthday, and he was in a car with some of his friends celebrating his birthday, and the car careened out of control, and did it hit a tree or a pole or? Yeah.
He was able to see again. He started tracking. He started moving his body. He stopped drooling. He started to eat, and this is all years down the line. And now, 10 years into the accident, he's finally back into therapy because he's finally understanding exactly what is going on.
Acute rehab. That's where the person will go into a rehabilitation facility. And very intense physical therapy, speech therapy, occupational therapy, cognitive therapy. And the whole purpose of that typically is to try to help the person regain some of the functions that they lost, help the cells that were damaged but not necessarily killed survive.